Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Welcome back, everyone. You're listening to Policy and Rights here on Depictions Media Radio, and I am your host, Michael Clogs. So today we're going to be listening to clips from the UN Security Council on topics around Ethiopia, Syria chemical weapons, and as we know, Haiti has suffered a number of natural disasters from earthquakes, storms, and of course they still suffering effects from the pandemic and COVID. Which case vaccinations haven't really happened too well there in Ethiopia because it's still hard to get aid in and out of that island for the people who actually need it. So we're also going to hear from the Pan American Health Organization, and they're talking about levels of vaccinations and things that we need to do to follow the health measures that are provided for us within our countries. And at some point that may or may not appear in the clip, they have talked about things like vaccination IDs and vaccination passports and some of the problems that it may be causing because of inequities around them. Some countries have moved forward with it, like here in Canada, have moved forward with the vaccination ID cards, and other countries have been hesitant to actually put them in place because of the inequities that they may actually cause, the discriminations that could happen around them. So it's kind of a mixed bag. The government, of course, and public officials, they're trying to do their best to ensure that safety protocols are met, but at the same time, how far to go, how far not to go, where to stop measures, and where to start measures. In another show, you're going to hear more from the Prime Minister of Canada and other party leaders about how to get work started, especially because of COVID and actually getting the members of Parliament into offices in Ottawa. And there's still going to be some backbiting and criticisms that are happening in different levels of government locally. So, again, we want to focus on the work that the UN is doing, and of course, in Syria, there's still a question around chemical weapons. Is Syria manufacturing chemical weapons? Are they using chemical weapons on their citizens, especially the political people who are in disagreement with the Syrian government? So let's listen to what's happening around the UN Security Council with, of course, Syria, Ethiopia, and Haiti. Thank you for listening to Depictions Media Radio.
Thank you very much. Mr. President, distinguished members of the Council, it is an honor to once more provide you with an update on the situation in Haiti, which is currently undergoing one of the most fraught periods of its recent history. Already reeling from the ghastly assassination of President Jovenel Moïse on 7 July, the country was struck on 14 August by a devastating earthquake which affected over 800,000 people in its southwestern peninsula. The two events have led long-awaited national and local elections to be further postponed. Meanwhile, insecurity has become rampant in Port-au-Prince as kidnappings are once again on the rise and gangs have extended their control over large swaths of the city. In addition, thousands of migrants who had sought better living conditions in neighboring countries are being repatriated. For most observers, it's difficult to envision an end to the country's seemingly never-ending crises, which have pushed the resilience of the Haitian people to the brink. Distinguished members, since assuming office on 20 July, Prime Minister Ariel Henry has spared no effort to reach a political agreement with the various factions of the Haitian polity. Adopting an inclusive and consensual approach, he has sought to create minimal conditions for the holding of legislative, local, and presidential elections, and thus steer a country in the midst of a profound governance crisis towards the regular functioning of its democratic institutions. In a positive step, actors from across the political spectrum and civil society organizations, including former opposition and ruling coalition groups, adhered to such an agreement on 11 September. The pact captures key demands expressed by national stakeholders, such as the formation of a new provisional electoral council and the inclusion of the diaspora. It also foresees the holding of elections no later than the second half of 2022. One can only hope that Haitian political and civil society leaders will continue to work together to find common ground around a common project that will contribute to fostering a more appeased climate in which decisive action can be taken and essential reforms enacted. To be sure, many points of convergence exist. For instance, there is a large national consensus on the need to reform the 1987 Constitution, a charter widely viewed as contributing to the recurrent political and institutional instability. The draft Constitution submitted by the Independent Consultative Committee to the Prime Minister on 8 September should provide a basis for further constructive and inclusive debate on ways to reshape the Haitian political system. Likewise, the reestablishment of security, especially in the Port-au-Prince metropolitan area, must be prioritized by Haitian authorities. Since June, a significant and sudden increase in gang violence has caused the displacement of some 19,000 people from the communes of Cité Soleil, Croix-des-Bouquets, Delmas, and the Port-au-Prince neighborhood of Martissan. The control that gangs exercise around strategic entry and exit points of the capital has had a detrimental impact on Haiti's economy and the movement of people and goods. Applying the recommendations of a team of UN police experts deployed from May to July, following a request from the late president, the Haitian National Police has sought to improve the effectiveness of its anti-gang operations by adopting a more balanced approach to prevention and repression, relying on increased police presence in problematic areas, and improving its intelligence gathering mechanisms. Yet an overstretched and under-resourced force alone cannot stem this worrisome rise in crime. Haiti's main security institution will not be able to achieve sustainable results unless its capacities are strengthened and government services are brought back to the impoverished neighborhoods that serve as fertile ground for armed gangs. Therefore, in addition to sustaining its efforts to reform the police with the support of the United Nations and bilateral partners, the government must implement a more holistic approach to addressing gang violence within the framework of the National Strategy for Community Violence Reduction, which was developed with UN support and endorsed on 5 July. Mr. President, Haitian citizens have unanimously condemned President Moïse's gruesome death and called for a thorough investigation into his assassination, one which follows due process and the rule of law. For the shroud of impunity which has long enveloped Haiti to begin lifting, and for justice to prevail in this as well as several emblematic cases, judicial actors must be allowed to work independently in an appeased environment with reassurance that they will be protected while undertaking the delicate task of identifying and prosecuting the perpetrators. The Haitian judicial system also continues to contend with the protracted challenge of pretrial detention, which affects 82% of the country's prison inmates, among the highest such rates in the world. National authorities must redouble their efforts to urgently address this issue in close consultation with all judicial stakeholders. Furthermore, it is imperative that the process to review the new penal and criminal procedural codes continue, as once promulgated, they will be critical to combating pretrial detention as well as harmonizing Haitian law with regional and international human rights standards. Distinguished members of the Council, the 14 August earthquake has added a new layer of complexity to an already dire humanitarian situation. In the face of the most recent catastrophe to befall the country, the United Nations reiterates its support to the government and people of Haiti and salutes the active national leadership and coordination of the post-disaster response and recovery. Even as relief operations are still ongoing, early recovery and the restoration of livelihoods must be strongly supported in areas affected by the earthquake. It is a race against time to ensure that children can return to school, that farmers do not miss the next planting season, and that people currently living in spontaneous displacement camps return to their homes as quickly as possible. We must ensure that Haiti does not become a forgotten crisis. I urge all member states to contribute to the $187.3 million flash appeal launched on 25 August to respond to the needs of those affected by the earthquake, as well as the $235.6 million 2021-2022 humanitarian response plan, both of which are currently only about one-third funded. Moreover, in the long term, the reconstruction process will need the full engagement of the government of Haiti, as well as the international community, to ensure greener, resilient, and more inclusive recovery. Similarly, while the United Nations and partners have worked closely with the government of Haiti to ensure it responds effectively to the COVID-19 pandemic, greater cooperation will be required to sustain and scale up testing capabilities, as well as to promote public health and social measures. With only some 60,000 vaccines administered to date and less than 1% of the country's eligible population inoculated, increasing vaccine uptake in the coming weeks and months will prove vital to protecting Haiti and its most vulnerable populations from COVID-19 and the threat of more transmissible variants. Mr. President, the situation in which Haiti currently finds itself can only be characterized as bleak. Nonetheless, there exist encouraging signs that only reinforce my conviction that through urgent, determined, and concerted action, Haiti's citizens can address the deep structural challenges as well as the governance and development deficits which feed their country's instability, insecurity, and ever-growing humanitarian needs. Along with the United Nations, the entire international community must continue to steadfastly stand alongside the Haitian people and their government as they endeavor to forge a path towards stability, security, and sustainable development. And I thank you.
Thank you very much, Mr. President. Mr. President, distinguished members of the Security Council, I thank Council members for the opportunity to brief you again on the implementation of Security Council Resolution 2118 on the elimination of the chemical weapons program of the Syrian Arab Republic. Since the last Security Council meeting on Resolution 2118, held on 2nd of September 2021, the Office for Disarmament Affairs has been in regular contact with its counterparts at the Organization for the Prohibition of Chemical Weapons, or OPCW, on its activities related to this matter. Per established practice, I held a monthly call with the OPCW Director General on 1st of October 2021 to receive an update and ascertain his views. As I have previously informed the Council, the ongoing COVID-19 pandemic has impacted the OPCW Technical Secretariat's ability to deploy to the Syrian Arab Republic. Nevertheless, the Secretariat maintains its readiness for deployments. Despite continued travel restrictions, the OPCW Technical Secretariat continues to undertake its mandated activities related to the elimination of the Syrian chemical weapons program and its engagement with the Syrian Arab Republic in this regard. Efforts by the OPCW Declaration Assessment Team, or DAT, are still ongoing to clarify all the outstanding issues related to the initial declaration by the Syrian Arab Republic to the OPCW. In this context, the OPCW Technical Secretariat remains of the position that the Syrian Arab Republic must declare all chemical warfare agents produced and or weaponized at the former Chemical Weapons Production Facility, or CWPF, that was declared by the Syrian Arab Republic as never have been used to produce and or weaponize chemical weapons. I have been advised that the OPCW Technical Secretariat has not received yet a response from the Syrian National Authority on the request for information and documentation regarding the damage caused to the declared former Chemical Weapons Production Facility, CWPF, during the attack on 8th of June 2021, reported by the Syrian National Authority. I urge the Syrian Arab Republic to respond to the OPCW Technical Secretariat as soon as possible, given that the damage caused to this facility is related to one outstanding issue recently opened by the DAT. As I have previously informed the Council, the Syrian National Authority also reported the destruction in the attack to the CWPF of 2 chlorine cylinders that were related to the chemical weapon incident that took place in Duma on 7th of April 2018. The OPCW Technical Secretariat additionally requested that the Syrian Arab Republic to provide information regarding the unauthorized movement of the 2 cylinders and any remains of their destruction. The Secretariat is still awaiting a response from the Syrian Arab Republic on this matter. Mr. President, I note that on 16th of August 2021, the Syrian National Authority responded to the OPCW Technical Secretariat's request to schedule the 25th round of consultations between the DAT and the Syrian National Authority. I understand the Syrian National Authority confirmed its readiness to hold the consultations from 11 to 27 October 2021. The OPCW Secretariat informed the Syrian National Authority on 25 August 2021 that the DAT was prepared to deploy in October 2021. It also expressed concern about how delays in the conduct of the consultations could impact Syria's compliance with its obligations under the Chemical Weapons Convention, as well as the implementation of the OPCW Secretariat's mandate. Unfortunately, on 23 September 2021, the Syrian Arab Republic reconfirmed to the OPCW Technical Secretariat its refusal to issue an entry visa to one member of the DAT for the upcoming deployment. In its response, the OPCW Technical Secretariat recalled that the DAT expert had deployed to Syria on multiple occasions over the past 7 years, and further referred to the applicable legal framework, which does not entitle the Syrian Arab Republic to select experts on behalf of the Secretariat. Given this regrettable situation, the Technical Secretariat confirmed that it would not deploy the DAT to the Syrian Arab Republic at this time. I have been informed that with the aim of advancing the implementation of the Syrian Arab Republic's obligations and the OPCW Technical Secretariat's mandate, the Secretariat has invited Syria to send a delegation for a meeting in the second half of this month with the DAT at the OPCW's headquarters in The Hague. The OPCW Technical Secretariat has underscored that such a meeting cannot replace full-fledged deployments to the Syrian Arab Republic. As a result of the identified gaps, inconsistencies, and discrepancies that remain unresolved, the OPCW Technical Secretariat continues to assess that, at this stage, the declaration submitted by the Syrian Arab Republic cannot be considered accurate and complete in accordance with the Chemical Weapons Convention. I urge the government of the Syrian Arab Republic to facilitate arrangements for the deployment of the DAT as soon as possible. As has been stressed on numerous occasions, it is only through complete cooperation by the Syrian Arab Republic with the OPCW Technical Secretariat that all outstanding issues related to the Syrian Arab Republic's initial declaration can be closed. As noted at many prior Council meetings, the confidence of the international community in the complete elimination of Syria's chemical weapons program depends upon these issues being finalized. Mr. President, the OPCW Technical Secretariat still plans to conduct 2 rounds of inspections of the Barza and Jamraya facilities of the Syrian Scientific Studies and Research Center, SSRC, in 2021. The inspections of these facilities remain subject to the evolution of the COVID-19 pandemic. I have been advised that the Syrian Arab Republic has yet to provide sufficient technical information or explanations that will enable the OPCW Technical Secretariat to close the issue related to the detection of a Schedule II chemical at the Barza facilities of the SSRC in 2018. With regard to the in-person meeting between the OPCW Director General and the Minister of Foreign Affairs and Expatriates of the Syrian Arab Republic, I note that the OPCW Technical Secretariat and the Syrian Arab Republic have appointed officials in charge of preparations. I hope that the proposed meeting will be an opportunity to strengthen dialogue and cooperation between both parties. Mr. President, The OPCW Fact-Finding Mission, or FFM, remains in the process of studying all available information related to allegations of the use of chemical weapons in the Syrian Arab Republic, and continues to engage with the Syrian Arab Republic and other states parties to the Chemical Weapons Convention with regard to, and I quote, a variety of incidents. As previously reported, further FFM deployments will be subject to the evolution of the COVID-19 pandemic. I understand that following the issuance of its second report in April 2021, the Investigation and Identification Team, or IIT, continues with its investigations into incidents in which the FFM has determined that chemical weapons were used or likely used in the Syrian Arab Republic. The IIT will issue further reports in due course, subject to the evolution of the COVID-19 pandemic. I take this opportunity to once again state my full support for the integrity, professionalism, impartiality, objectivity, and independence of the work of the OPCW. Mr. President, on 21 April 2021, at its 25th session of the Conference of the States Parties to the Chemical Weapons Convention, adopted Decision C-25/Decision 9, entitled Addressing the Possession and Use of Chemical Weapons by the Syrian Arab Republic, suspending the rights and privileges of the Syrian Arab Republic under the Convention. According to paragraph 8 of this decision, the rights and privileges of the Syrian Arab Republic will be reinstated by the Conference of States Parties once the OPCW Director General has reported to the Executive Council that the Syrian Arab Republic has completed all of the measures contained in paragraph 5 of the Executive Council Decision EC 94 Decision 2. I have been advised that the Syrian Arab Republic has yet to complete all of these measures. I therefore reiterate once again my call to the Syrian Arab Republic to cooperate fully with the OPCW Technical Secretariat in this regard. Mr. President, distinguished members of the Security Council, it cannot be repeated often enough. There is no justification for the use of chemical weapons by anyone, anywhere, and under any circumstances. There are no excuses for an inexcusable act. We must remain united and determined in preventing their use or the threat of their use. Those who have used chemical weapons must be identified and held to account. It is an obligation on all of us. It is my sincere hope that members of this Council will unite on this issue. Before closing, I wish to echo the Secretary General's remarks to the General Assembly presenting our common agenda on 10th of September 2021. And I quote, "When we work together, there is no limit to what we can achieve." I thank you very much for your attention.
I thank Ms. Nakamitsu for her briefing. I now give the floor to the representative of Ethiopia.
Thank you, Mr. President. Congratulations on assuming your presidency for the month of October. I would like to convey Ethiopia's best wishes in the discharge of your responsibilities. I also thank our Secretary General. Mr. President, I don't want to hide my surprise in the convening of this meeting of the Security Council. We find it incomprehensible for this august body to discuss the decision of a sovereign state exercised within the domain of international law and sovereign prerogative. There have been several instances where governments had expelled UN staff and other diplomatic envoys for so many disclosed and undisclosed reasons. Did the Council ever meet to vindicate such a decision? Not to the best of our recollection. Mr. President, we truly hoped Council members would have the insight to leave this matter to the government of Ethiopia and the United Nations. At the outset, I would like to register our position that the government of Ethiopia is not under any legal obligation to provide justifications or explanation for its decisions. Excellencies, we are obliged to make reference to the basic norms of the United Nations and its humanitarian operations. The General Assembly resolution on guiding principles for humanitarian assistance, 46/182, provides the sovereignty, territorial integrity, and national unity of states must be fully respected in accordance with the Charter of the United Nations. The most fundamental element of the sovereignty of the state has to do with their prerogative to determine who enters, remains in, exists in their territory. When we appeal for support and work with the UN or other humanitarian operators, we have not foregone this fundamental right. Therefore, the government will continue exercising its due right and responsibility on monitoring and screening all humanitarian operators in Ethiopia. Any suggestion to the contrary is unacceptable. As to the legality of the decision, leaving the details aside, the UN itself can be quoted for arguing decisions of persona non grata apply to the UN as well. Mr. President, when it comes to the obligation of UN staff, the rules are unequivocal. Article 101, paragraph 3 of the UN Charter provides all staff members employed by the United Nations must have the highest standards of efficiency, competence, and integrity. In the context of humanitarian operations, integrity entails adhering to principles of neutrality, impartiality, humanity, and independence. It also requires respect for the laws and police power of the host state. Furthermore, they must respect the code of conduct of UN, which, among others, provides the following. First, UN staff shall neither seek nor accept instruction from any government or from any other source external to the organization. Second, staff members shall not use their office or knowledge gained from their official functions for private gain, financial or otherwise, or for the private gain of any third party, including family, friends, and those they favor. Third, staff members shall not communicate to any government, entity, person, or any other sources any information known to them by reason of their official position. These cardinal principles, for the safeguard of which UN staff enter a solemn oath and swear on their conscience, mean that in the presence of contradicting views, competing interests, political pressures, and all forms of temptation, the UN staff will remain neutral. In the presence of deceit, coercion, and vested interest, they will preserve their independence. And in the existence of consideration that may appear to be reasonable basis for decision, UN staff will be guided by humanity only. The UN staff, Ethiopia expelled, sidelined their oaths, the rules of professional conduct, and the principles of humanitarian assistance. Mr. President, let me cite few examples among the multitude of transgressions that we selected with great care and caution. Needless to say, the misconduct of few individuals doesn't speak to the professional and able team of the UN in Ethiopia or anywhere else. Rather, it speaks of the serious ethical dilemma that existed in the humanitarian operation in Ethiopia for the past 11 months. These individuals executed the conspiracy created by TPLF and its member to generate an image of extreme casualty that warrants quote-unquote humanitarian intervention and rescues the criminal group. To use their own words, they were looking to create a Darfur-like situation. They suddenly and overnight created 1 million victims of health disaster, while OCHA country office reports 2.8 million people that need emergency health assistance. The main OCHA office was made to report 3.8 million, only because that level of inflation of misery was needed to elevate the crisis to level 3. They categorized the situation in Tigray under IPC 5, based on data collected from a region of 6 million population by a single FAO staff and interpreted by 2 UN staff that are Ethiopian and open TPLF supporters based in Rome. They assisted in fabrication of false allegations submitted to the UN Security Council as a white paper. The white paper contained unfounded allegations, including the use of hunger as a weapon, and proffered the need to apply Resolution 2417/18. The former head of OCHA was made to report to this council 152 Ethiopians died due to food shortage, while such incident had never occurred. They made up the data and went to the extent of disinforming this global security body. About 2 weeks ago, they reported 12 individuals died of hunger in an IDP camp, while the organization running the IDP camp, an internal organization itself, came out and stated the allegations are simply false. They implored UN agencies to conduct investigations outside of their mandate to meet the instruction of TPLF to generate exhibits matching the false allegation released on medias and to supposedly substantiate a case before the ICC. They didn't even show mercy to victims of gender-based violence. First, in violation of the protection of protocols of safe houses for victims of gender-based violence, they invited TPLF armed men and militia to the safe houses. In addition, they exposed the safe house before an international media and invited interviewers and interrogators to safe houses to intimidate victims and elicit testimonies. This, Mr. President, is happening in a city where close to 13,000 detainees and prisoners were released with absolute impunity, and thousands of armed youths are roaming in the streets, already creating terror on residents. These individuals recorded a UN staff meeting and gave a copy to TPLF for the sake of providing it with material it could use to back its false allegations. These individuals openly celebrated and make other UN staff cheer the so-called victory of TPLF and the withdrawal of the National Defense Forces from Tigray. They openly conducted activism in support of TPLF, a group proscribed as terrorists, and make political statements that instigate violence and inflame the conscience of the Ethiopian public. They assisted siphoning food, medicine, communication equipment, all other essential supplies and equipment and transfer to TPLF. Right before their expulsion, they were facilitating the deportation of ethnically segregated group of Ethiopian migrants from Saudi Arabia and their resettlement in third country in Africa for training and preparation before they join combat with TPLF. In effect, a parallel UN operation that completely sidelined the UN country office was created. Apart from the selfish interest of individuals, we have evidences that the entire endeavor is created by a higher and more sophisticated motivation that seeks to undermine the Ethiopian state and rescue the TPLF. Ethiopia deeply resents this experience. Mr. President, expulsion was not our primary course of action. In multiple occasions, we explained our concern to UN officials. On July 8, 2021, the Deputy Prime Minister and Foreign Minister of Ethiopia wrote a letter to the UN Secretariat explaining in great details the misconducts of the UN staff that require corrective measures. We also summoned some individuals and warned them to halt their misconduct. Nevertheless, the transgression continued unabated. Mr. President, we believe the UN agencies and their honorable role are undermined by these few individuals. Our request from the United Nations is, first, to deploy new staff that are aware of and will adhere to their professional code of conduct. Overwhelming majority of UN staff fulfill this requirement and would distance themselves from political mercenarism. The government of Ethiopia stands ready to assist expeditious deployment of the replacement. More importantly, we request the UN to review all the reports, statements, and assessments that were produced on the situation in Ethiopia in the past year. These reports and data and information they contain must be verified. This audit is necessary for us to build and sustain trust and advance the exemplary cooperation between the Ethiopian government and the United Nations. Mr. President, the United Nations is an invaluable development and humanitarian partner for Ethiopia for many years. I want to underscore the great values we attach to the support of our organization during this difficult time. We also believe majority of the UN staff we have the privilege of working with have the requisite integrity and decency. Mr. President, I would like to reassure this Council the new Ethiopian government established with the popular will and mandate of the Ethiopian people to herald peace and prosperity stands ready to work with the international community to address long-standing and current challenges. We welcome and value initiative by leaders of our region, the African Union, and the support of the Secretary General Antonio Guterres toward sustaining peace and stability in Ethiopia. We assure you that we will facilitate the visa requests. No one should doubt the Ethiopian tradition of hospitality. What we ask is respect, dignity, and honesty, open and candid discussion. We will, as we did in the past, we will always stretch our hands to all those who treat us with dignity and equality. That is indeed the story of an Ethiopian life since the time of the League of Nations. I thank you.
I thank the representative of Ethiopia for his statement and invite the Secretary General of the United Nations to take the floor.
Thank you very much, Mr. President. If there is anything I have cherished during all this period, is to maintain a very effective and operational relationship with the government of Ethiopia and with its Prime Minister. To the effect that I had many criticisms in the global media about that, accusing me of being biased in favor of the Ethiopian government. So it is with total I would say, in a spirit of complete easiness, that I would like to ask you one thing, Mr. Ambassador. If there is any written document provided by the Ethiopian government to any UN institution about any of the 8 members of the UN that were expelled, I would like to receive a copy of that document, because I have not had any knowledge of any of them, and it would be very useful for me to detect if documents are given to the UN and not given to my knowledge. Then I have to investigate what has happened in my organization. So I ask you, please, Mr. Ambassador, to provide me as a copy of any of the written documents written by the government of Ethiopia about any of the 8 that were expelled by Ethiopia in this regard. And I would recall that twice I told the Prime Minister that if there were concerns about lack of, I'd say, lack of impartiality of the UN staff, that I asked him, please send me those situations for me to be able to investigate. Twice I asked it to the Prime Minister. Until now, I had no response to these requests. And so, for us, the question is very simple. We believe that Ethiopia has not the right to expel these 8 members of the UN. We believe Ethiopia is violating international law in doing so. And we are ready to cooperate with the government of Ethiopia in relation to any situation in which the government of Ethiopia feels that any member of the UN is not behaving in total impartiality, in total independence, as humanitarian law prescribes and humanitarian principles establish. I want to tell you, Mr. Ambassador, we want to cooperate with the government of Ethiopia because we have only one agenda in Ethiopia, and that agenda is the people of Ethiopia. Tigrayans, Amarans, Afaris, Somalis, the people of Ethiopia. The people of Ethiopia is suffering. We have no other interest but to help stop that suffering. Thank you very much.
I thank the Secretary General for his further clarification. The representative of Ethiopia has asked for the floor to make a further statement. I give him the floor.
Thank you, Mr. President. Mr. Secretary General, I hear you loud and clear. I fully understand and realize the support you have given to our people and my government as well. We know where your heart is. You have approached our issue with candidness, with candor, and we highly respect that. As to the asks, I will definitely communicate to the appropriate authorities, and we will, of course, expeditiously, and as I have made it clear in my statement, this is an issue that has to be dealt between the Ethiopia and the United Nations. Whatever document that will be available will be submitted to your office, Your Excellency. I thank you.
Thank you for listening to Depictions Media Radio.
Question. Let me thank sincerely all of you who have joined today's press briefing. For the last month, we have seen COVID infections drop throughout the region, even if cases remain high. Over the last week, nearly 1.2 million COVID-19 cases and 24,000 COVID-related deaths were reported in the Americas. In North America, while cases are down in the US and Canada, Mexico is reporting a jump in new infections. But national data doesn't tell us the whole story. If we look deeper, we see that local trends remain worrisome. Many southwestern Canadian provinces are reaching their highest hospitalization and ICU peaks since the beginning of the pandemic. And in the state of Alaska, which today reports the US's worst COVID outbreak, emergency rooms are overwhelmed with COVID. Patients and doctors face difficult choices about how to allocate hospital beds. Across the Caribbean, infections are going down overall, although Cuba and Bermuda continue to report high rates of new infections. And Barbados saw cases increase by nearly 75% over the last week. In Central America, while cases are decreasing throughout the subregion, Costa Rica continues to see high rates of hospitalization and ICU bed use. Hospitalizations have also jumped by 2/3 in Belize. In South America, while countries are continuing to see a drop in infections, Chile is seeing a jump in new cases. driven primarily by outbreaks in urban centers like the metropolitan region of Santiago and the port cities of Coquimba and Antofagasta. As we look across the region, we are reminded that governments need to keep a close eye on local trends because infection dynamics vary widely within each country, in part due to differences in vaccine availability and uptake. This more localized approach will be key to keeping outbreaks under control. Today, just 37% of people in Latin America and the Caribbean have been fully vaccinated against COVID-19. As 7 countries and territories in the Americas have vaccinated more than 70% of their populations, just as many have yet to vaccinate 20% of their populations. Jamaica, Nicaragua, and Haiti have yet to reach even 10% coverage. We must focus our attention to close this gap as quickly as possible. In just the past week, 875,000 vaccine doses arrived in countries across Latin America and the Caribbean. But we know these are not enough to protect everyone. So we continue to urge countries with surplus doses to share this with countries in our region where they can have life-saving impact. Let me assure you that PAHO is doing everything it can to accelerate vaccinations in the Americas, from delivering COVAX doses to supporting donations to purchasing vaccines on behalf of our region and establishing a platform to ramp up vaccine manufacturing in our region. I am pleased to announce that PAHO has already closed agreements with 3 emergency use listing authorized producers: Sinovac, Sinopharm, and AstraZeneca. We are now in conversation with our member states that want to use this alternative for direct purchasing through the revolving fund. We now have vaccines from Sinovac and AstraZeneca available this year, and also from the 3 producers to 2022. Whether it's getting vaccines to our region or tracking the spread of variants, controlling this pandemic rests on the work and support of partners across our region and indeed the world. And just as we work together to control this pandemic, we must consider the ways in which we can collaborate to avoid future pandemics. COVID-19 has been unique in its scale and impact, but it is not the first emerging disease to cause ripple effects throughout the world. Whether it's COVID-19, Ebola, chikungunya, yellow fever, avian influenza, or Zika, we've seen that diseases that spill from animals to people can have severe impacts. We have a list of emerging pathogens that have the potential for public health risk, and almost all of those are either zoonotic, meaning that they can transmit from animals to people, or common to humans and animals. As climate change impacts ecosystems, and as people come into closer contact with animals via urbanization and deforestation, the potential for spillover is increasing. The health sector plays a critical role in managing this risk, but it can't do it alone. And that's why it is crucial that pandemic plans and policies reflect the expertise and the recommendations of public health, animal health, and environmental sectors. This is especially critical in a region like our own, which has tropical zones with high potential to harbor new diseases like the Amazon Basin, Gran Chaco, the Lacandon jungle, the Darien Isthmus, and La Mosquita. The economies of many countries in the Americas also rely heavily on agricultural production and exportation. So the threat of animal diseases looms large and has the potential to impact entire industries and national development. And of course, the risk for a new pandemic. A One Health approach has long been a priority for PAHO. For more than 70 years, PAHO has hosted a veterinary public health program that works with both public health and animal health sectors on zoonotic diseases and food safety. In the late 1990s, PAHO developed a strategy for strengthening surveillance of emerging infectious diseases that includes the human-animal interface. And that is a defining feature of One Health. Our integrated surveillance leverages animal health institutes to monitor animal and human diseases, conduct joint risk assessments, and host workshops and trainings on issues like yellow fever. Recently, ministers of health at our directing council approved a new One Health policy that outlines a blueprint for countries to bring together experts and officials from across sectors to address some of the most challenging issues of our time, including zoonotic diseases, food safety, antimicrobial resistance, and climate change. We need countries to ensure that animal and environmental partners are brought together to build more robust surveillance systems that can detect risk faster, prioritize investments in research and development for high-risk pathogens, and establish strong pandemic responses that build on the strengths of these diverse areas of expertise. Because the cost of preventing a pandemic is much less than the cost of responding to one. COVID-19 alone has caused a loss of some 4 trillion US dollars in global GDP, and we're not yet out of the woods. So in the months ahead, as countries revisit their health budgets, rethink how they deliver healthcare, and engage in global efforts to prevent the next pandemic, we want to urge everyone to build on this One Health approach as the smartest, most effective way to protect ourselves from the next crisis that can lead to a global pandemic. Let me thank you.
Now, several questions from Peru. Please, Vilches Hurtado from Zona País, from El Comercio, asks, what are the reasons why there's a delay in shipping of vaccines to Peru? And the question is, so far, how many doses of the total that have been contracted through this mechanism have been sent to Peru, and will they be sent this year or maybe next year now? And another question from Chris Vilches is that Peru has 42% of the population already received 2 doses of the vaccine, and within this context, they have started to give their third dose to health care workers, and they want to know whether this is the correct measure to follow. Dr. Barbosa. Thank you for your question. Unfortunately, the delay in shipments by COVAX, it's not only for Peru, but for all countries participating in this facility. There are many reasons. First of all, problems with some manufacturers who are not prioritizing the shipments for COVAX facility, but they prioritize their bilateral agreements, but because in those bilateral agreements, the vaccines are more expensive than the price they give for COVAX. Secondly, COVAX had a significant problem because one of the largest manufacturers for 2021, which is the Serum Institute from India, has been forbidden to export vaccines. So there are about 500 million doses outstanding that have not been delivered. So that's why most countries, and Peru included in there, only received about 30% of the vaccines that they contracted through the mechanism. Peru has received about 2.5 million doses of COVAX vaccines, and they have new vaccines that will be arriving in the country in the next few weeks through COVAX again. So it is important to learn this. PAHO has always said that the priority should be the lowest coverage of some countries to prioritize shipments, and COVAX has accepted this criterion, and therefore we're going to have the countries that are below 10% in the region, below 10% vaccine coverage will be receiving as a priority vaccines in October. And COVAX has said that they won't be able to deliver for the 20% of the population that they have committed to for the end of this year, but they will be close to that figure. They hope that by November and December they will have sent many more vaccines, so more vaccines will be available, but it will take until the beginning of 2022 to meet all the contracts they signed with the countries. That's why PAHO is working, in addition to accelerating access through COVAX, to also seek for more donations. Donations have been essential during August and September so that countries were able to have more vaccines, and we're also offering the possibility of doing purchases of vaccines through the revolving fund directly, that all countries in the region can send their requests to the revolving fund of our organization. Excuse me. Regarding the third dose, I forgot that part of the question. Regarding the third dose, to this point, there is no recommendation by the group of experts from WHO, from the SAGE group. This is the strategic group of experts. They are currently reviewing all the data, and it takes time because, as I said before, it varies for each vaccine. There are some vaccines that may reduce protection over 6 months, 8 months, a year. Other vaccines will take longer. So we cannot make a general blanket recommendation. We know that healthcare workers are a priority group, as well as older individuals, and each country is making their recommendations based on the vaccines that they have used and on the data they have, as well as the availability of vaccines they have, because you cannot make a blanket recommendation. Oh yeah, start giving the third dose, because in many countries, unfortunately, there are still people from priority groups who have not had access to the first dose. So each country needs to have their own strategy and adopt the one that deserves. Thank you very much. Thank you, Doctor. Next question is by Orville Williams from Antigua Observer in English, and it's
recommended do's and don't for countries social protocols are concerned. Dr. Alighieri?
Yes, thank you for this question from the Antigua Observer. The concept of herd immunity could be misunderstood. This is a theoretical concept that implies some important caveats, as, for example, the existence of a very large population that is perfectly mixed. And that is hardly ever the case. This herd immunity is also unlikely to be a fixed threshold, and it will vary depending on several factors, such as how much people usually interact, which SARS-CoV-2 variants dominate and how immunity wanes in the population. This is why we should not make public health policies based on whether we think herd immunity has been reached or not. For several months, PAO has advocated for the adjustment of a combination of public health and social measures depending on the epidemiological situation. That remains our main recommendation going forward. Even when community transmission diminishes, we can still experience outbreaks under particular situations, such as in confined environments or from super spreading events. We do expect that as vaccination coverage increases substantially and uniformly across all age groups, vaccination will gradually contribute to the population immunity and thus contribute to decrease in transmission. However, the extent to which vaccination will contribute to that is still an open question, primarily because we see with great concern how vaccine hesitancy is prevalent, especially in the Caribbean. So in this context, people who are eligible for vaccination and are offered vaccination should embrace this opportunity as a way to protect themselves from serious consequences and to protect others in their families and in their communities. I hope I have answered the concerns of the journalist in Antigua and Barbuda. Thank you.
Muchas gracias, doctor, y ya estamos llegando al final.
Thank you very much, Doctor, and we're reaching the end of today's session. The next question is by Laura Barros from the EFE agency. She's saying that the region of the Americas is facing a challenge with mass migration, and she's asking what are PAHO's recommendations to the countries in the region to help these individuals that are moving in the midst of a pandemic. Dr. Etienne.
Question. As all of us know, in our region, we have seen mass migration in the Northern Triangle, but also originating from Venezuela. This mass migration has generated increased health needs of both the migrant population and the host communities. And some of those needs, the main ones include maternal and child health care, emergency care, the prevention and control of communicable diseases, vaccination, including vaccination against COVID-19 and others. In areas near borders and in entry points, countries need to prepare health services so there is enough staff, equipment, supplies, especially for maternal and child care, medical emergencies that are related to injuries, which may very well occur during travel, acute events, and referral of patients to more complex health facilities if and when necessary. So PAHO, with the financial cooperation of the United States of America, the European Union and others, has facilitated the provision of services for more than 2 million migrants. And these services include immunizations, consultations, emergencies, mental health, and others. We have worked to support national health authorities in Brazil, Colombia, Ecuador, and Peru. We have strengthened some 112 first-level care facilities and 84 hospitals covering equipment, medicines, and supplies, and have supported 18 public health laboratories and 25 emergency operations centers. Some 16,000 health workers and more than 20,000 community agents were also trained in face-to-face workshops and virtual courses. PAHO is facilitating the coordination of the international health response in the countries of the region. And we lead the health group of interagency regional platforms for refugees and migrants of Venezuela. We are also actively participating in the Quito process, promoting the incorporation of migrant healthcare into the policies and plans of the countries to ensure access to health services for the host communities and the migrant population as well. The commitments of countries to universal health access and universal health coverage requires that we address the health needs of migrants. And I'm very grateful to the member states of our region that have made efforts to ensure that the health needs of migrants are planned for and are met. This is a responsibility that we have as a general community within the region. So I thank you again for joining us today. And let me remind you, please get vaccinated ASAP as soon as possible. And please continue to observe the public health.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information and click on our contact link and let us know how we can help. How we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.